Joint replacement surgeries such as total knee and hip arthroplasty are increasingly common treatments for severe joint diseases. However, the recovery process can be challenging, often marked by pain, swelling, and limited mobility. Cryotherapy, which involves applying cold to the surgical area, has become a popular non-drug method to help manage these symptoms. But does it really work? Recent systematic reviews and meta-analyses have tried to answer this question by pooling data from multiple randomized controlled trials. In this video, we'll explore what the latest evidence says about cryotherapy's effects on pain, blood loss, range of motion, and overall recovery after joint replacement. Let's start by understanding why cryotherapy is used and what outcomes matter most to patients and clinicians. Comprehensive review of 21 randomized controlled trials, covering over 1,400 patients who underwent knee or hip replacements, sheds light on cryotherapy's real impact. For knee replacements, cryotherapy was found to significantly reduce pain on the second day after surgery and lower the need for painkillers. It also helped limit changes in hemoglobin, reduce blood loss into soft tissues, and decrease drainage output. However, when it came to hip replacements, cryotherapy only reduced pain during the first 2 days and didn't show significant effects on painkiller use or blood loss. Surprisingly, cryotherapy did not improve joint range of motion as many hoped. The studies also found no evidence that cryotherapy increased the risk of complications, nor did it boost patient satisfaction, reduce swelling, lower transfusion rates, or short hospital stay. These findings suggest that while cryotherapy offers some early pain relief, its benefits may be limited and depend on the type of surgery. While the evidence points to some benefits of cryotherapy, especially for knee replacement patients in the first days after surgery, there are important limitations to keep in mind. The quality of the studies varied, with many showing moderate to high risk of bias and small sample sizes. The protocols for cryotherapy, such as temperature, duration, and device used, were not standardized across studies, making it hard to compare results directly. Furthermore, the evidence for hip replacements is weaker, and there's little data on other joints. Overall, cryotherapy appears safe and may help with early pain control, but it's not a magic bullet for recovery. More large, high-quality studies are needed to confirm these findings and guide best practices. For now, clinicians should consider the type of surgery, patient preferences, and available resources when deciding whether to use cryotherapy as part of rehabilitation. Summary: cryotherapy can be a helpful tool for managing pain and reducing some early complications after knee replacement surgery, but its benefits are less clear for hip replacements and other joints. It does not seem to improve joint mobility or speed up overall recovery, and it doesn't increase the risk of adverse events. The decision to use cryotherapy should be individualized, taking into account the type of surgery, patient needs, and the available evidence. As research continues, we may learn more about which patients benefit most and how to optimize cryotherapy protocols. For now, it remains a safe, simple option for early pain management in joint arthroplasty rehabilitation.